So as a pediatric cardiologist, I have personally seen kids have their hearts and be devastated by COVID, be incredibly sick from COVID and die from COVID. And I am so excited to have my daughter be protected from COVID by the vaccine. But of course, one of the things that I want to show today is that as a physician and a parent, I believe in this vaccine as the right thing to do to protect our children. So when my daughter had the opportunity to be involved in this, it was a really simple decision. I needed to show everybody that it is the right thing to do to get our children vaccinated.
It was basically like a flu shot, but it didn't even take a minute. It basically just took a couple of seconds and then it was over.
And I know and I trust in the science of the vaccine, and I don't ever want to see my child ever get COVID, and this is the best and safest way to do it. It's an effective way to do it, and it's going to help all of us have lives again and help her have a normal childhood, which she's been deprived of over the last 18 months, and so I really want to get her moving forward.
It was great knowing that I could now be with some of my family members that are like a little older.
Good morning, everyone. My name is Prathichi Goenka, and I'm a pediatric hospitalist here at Cohen Children's Medical Center. I'm here with my husband, Anuj, and my children, Arav, who's 9, and Unmay, who's 8.
I mean, I've been talking to the public and my community about getting the vaccine as soon as it's available, and I wanted to hold true to my word and be able to be a part of this today so that we could get him as close to first in line as possible, because we want to move forward with our lives. We want to be able to enjoy the holidays coming up and go travel to see family. We know vaccines are being required by other countries to travel. We also know that, we have elderly family members. We don't want to have any transmission in our family, and we think that if less people are infected in a community, then there's less risk of getting infected, and the only way to do that is to reduce the number of people getting sick. So vaccines can help reduce the number that people are getting sick in a community.
Just go out to places I can normally not go to.
Like what places?
Chuck E. Cheese, restaurants, and places like, I don't know.
And I was just having such a moment of pride and really just a moment of such relief that I don't have to worry about him being a patient and becoming sick.
Pediatrics and runs our really large general pediatric clinic. It's clear that the kids down to these ages are some of the major spreaders. And even though in general the disease is milder in kids, than it is in adults, particularly those with comorbidities. There are plenty of children with comorbidities.
This is a big day that kids now who are school age can also be vaccinated themselves. And the vaccine works. So we're a little bit closer now to allowing our kids just be kids again, so that they can go to a play date at someone else's house without as much worry, that they can travel and do their after-school activities with a little less worry, that they can hug our grandparents and great-grandparents with a little less worry, and then maybe one day even be able to go to school without masks. So for specialty practices, as well as children of our